And we do, as I've been promising you this morning, have as our guest Dr. Amini. Is that correct?
Yes, that's correct.
And good morning to you.
Good morning, sir.
Happy to have you in the studio, and you are in charge of the ER, right?
Yes, happy to be here.
Well, I tell you what, the ER at Missouri Baptist is one busy place, isn't it?
Yes, it is, sir. Yeah.
Tell us a little bit, how does it work? You have several different doctors that are on duty throughout the day, or how does that work?
On any given time, we do have between the peak hours of 12 noon to 12 midnight. Actually starts at 11 o'clock. We do have a mid-level provider who is also a nurse practitioner or a physician assistant, and at the same time we have 24 hours a day a physician present as well.
So there's as much help as you can possibly get in there.
Uh-huh.
You know, I understand that the ER room at Missouri Baptist is as busy as some of the bigger hospitals. Is that right?
That is correct, yeah. We do see at least about 22,000 plus a year, our annual census.
Wow, that's a lot a day, isn't it?
Yes, that is correct.
How does it work? I understand that if you have a car wreck and you have an emergency, you're going to take priority there. How are those decisions made?
Emergency departments are basically serves to help the folks in our local communities and also folks that are traveling across Sullivan with true emergencies. That means heart attacks, strokes, any type of really bad car accidents, they come in to us. And those patients will always take priority over the other patients who are seem non-urgent or non-emergent, but still very important to take care of those patients. It's just that they take precedence as far as being seen first.
Yeah, if I'm in there in the middle of the night with a sprained ankle or something and you're dealing with somebody who's been in a car wreck, I just need to understand you're going to get to me as soon as you can.
That is true.
I know, though, they do a good job of coming out and talking to the patients and letting folks know what's going on, and that's important too, isn't it?
Yes, that is very important, because at every step of the way the patients need to know exactly how long they're going to be waiting for, and if there's a more critical patient that needs to go ahead of them, we usually try to do our best to let them know each and every time.
And you can really handle quite a few patients at once, though, as well.
Yes, so we do have 12 beds currently available, and we also have hallways that we can also put in patients if we need to. But obviously, the more critical patients will be in the rooms.
You know, you talked about heart attack. I think a lot of folks maybe need to be at the emergency room that put that off, don't they?
Yes.
And I mean, even if you think it might be indigestion or you think it might be something, I've never had the problem yet.
Sure.
But if you think of that, should you go to the hospital? Should you go to the emergency room if it's in the middle of the night?
Yes, so even if it's the middle of the night, or if you have any signs of any chest pain, difficulty breathing, any type of bleeding, or you feel like you passed out or feel like you're going to pass out, first thing you need to do or have a loved one call 911. That's the most important thing.
What are the signs of a heart attack?
Signs of heart attack can basically be anything. Like you said, something as simple indigestion may actually be a heart attack. Pain in your left arm, pain in the middle of your back that you never had before, any type of chest pain, or even pain above your stomach area can also be heart attack.
Are they different for men and women, or is it the same?
They're actually, they do present differently, and also depends on the patient's condition. If somebody's a diabetic, they may not have the same signs and symptoms as somebody who's a non-diabetic, but it can present many different ways. Obviously it is different in men and women, and like I said, any type of chest pain, shortness of breath, arm pain, or feeling lightheaded, or any type of dizziness symptoms, all of those need to be checked out.
And are those symptoms different than symptoms from a stroke?
Stroke symptoms, again, can also, there's a lot of areas where the two kind of coincide as far as feeling dizzy, lightheaded, also difficulty with your speech, or feeling weak in one arm or one leg. All of those are symptoms of stroke usually.
And is it important to get medicine as quickly as possible for that?
Yes, that's why it's very important that as soon as our patients can, they should call 911 or have a loved one call 911 for them, and be seen in the hospital as soon as possible, because it does make a difference.
Now you're dealing with those kind of things, but you're also dealing with bicycle wrecks, and as I said, sprained ankles and all of that as well, aren't you?
That's true, yeah. Being close to the 44 here, we do see patients, lots of them come in with all sorts of motor vehicle accidents, and also your simple bike accidents and other things. And those are more the trauma patients, and they can happen. And that type of trauma can happen, obviously, at any age, very young patients to the very old.
The Missouri Baptist Hospital facilities, they're really, really nice facilities, aren't they?
Yeah, the administration has done a very good job, and BGC in general, to make sure to make all the improvements that are necessary, and there's always room for improvement.
Now, are the emergency room doctors, are they Missouri Baptist Hospital doctors, or how does that work?
They're actually, the emergency physicians are part of a local group that we form ourselves, and it's all through the Emergency Consultants Incorporated that basically sets up small groups within each hospital area, and we're basically the ones in charge.
When you go through medical school, was that your plan to be an emergency room doctor?
Probably later on. Later on, you make that decision as far as what's the right path for you. For me, probably was towards the latter half of my medical school.
When you're doing residency and trying all the different things?
Exactly.
And that really does help you decide what you want to do. But you've got to be quick on your feet, don't you? In the emergency room, you're seeing everything.
Right, exactly. Because there are times that we have patients that you maybe only 2 to 3 patients in the ED, and there may be times where you have 12 or 14, and you may have 5 or 6 patients waiting in the waiting room for you as well. So you do have to make quick decisions, and again, we're there to make sure that the patient does not have an acute emergent medical condition that we can take care of.
But if you're a pediatric doctor, for example, you're taking care of children all the time. As an emergency room doctor, you're seeing all age groups.
That is true, yeah. We do see patients all the way from a week old all the way up to over 100. And they obviously come in with different sorts of medical problems, and you have to be ready to manage them.
Yeah, it's got to be pretty challenging, too.
Yes, it's definitely a challenge, but it's definitely something that we train for and we look forward to.
And what about your training? Where did you go to school?
Went to upstate New York in Syracuse. That's where I did my emergency medicine training, and then subsequently started working at different hospitals, and then ended up here in Sullivan.
So have you pretty much been in emergency rooms then
since
your residency?
That's been my specialty, yes, emergency department.
And I didn't realize that there were doctors that did that studied to be in the emergency room.
Yes, actually it's been a specialty for over 20 years.
Really?
Before, it used to be that physicians with different specialties, such as internal medicine or family practice, used to practice. But over 20 years ago, the specialty was set up where you're specifically trained to take care of emergency patients.
We are talking with Dr. Amini, who's the ER doctor, head of the ER at Missouri Baptist in Sullivan. And I know that, the few times we've used Missouri Baptist emergency room, in the middle of the night or whenever, it was pretty quick. I know you try to get people through just as quickly as you can.
Right. We do make every effort as possible to try to get our patients seen as soon as possible. And so as soon as you walk into the door, you're initially seen by the registration folks who take in the demographic information. And then you're triaged by one of the nurses, usually within 5 to 10 minutes, sometimes as little as a minute or so, depending again on how severe the patient looks.
Now, I'm at the hospital quite a bit, and I see a lot of ambulances. I see not only Missouri Baptist ambulance, but I see North Crawford County and Steelville and a lot of other ambulances that use your emergency room.
That is true. Yeah, we do have folks coming in from pretty much all over the surrounding areas, and depending on how close the patients are or if they want to be seen specifically at our centers, we can see folks from far away.
Now, when that ambulance is bringing somebody in, let's say from the Cuba area or something, are those attendants on the are they in contact with the doctors in the emergency room if it's a real emergency?
Yes, they're always all in contact with our emergency department in terms of looking for medical direction if they need to speak to myself or one of the other ED providers. Or sometimes they talk to the charge nurses and letting them know exactly what is their estimated time of arrival to the ED, or if they need any type of specific direction, they're always welcome to reach us.
And of course, that gives you in the emergency room the opportunity to be more prepared then, right? For what's coming in.
Yeah, it's always very important to be prepared ahead of time to know what kind of patients are coming in, so you can get the appropriate personnel ready to go, and also the other staff members as well.
And I also see, the helicopter comes in there quite a bit from the accidents and that sort of thing, but then that helicopter leaves with patients quite a bit, doesn't it?
Yes, definitely. There are times when one of the benefits of coming to our emergency department is that we are also affiliated with Barnes and Missouri Baptist Medical Center, and also St. Louis Children's Hospital. And anytime when there's higher level of care that's needed and it's an emergent condition, We do have access, weather permitting, to two different air ambulance services to transport patients.
And, I've always said that the ambulance personnel at Missouri Baptist and the emergency room and the helicopter people saved my granddaughter's life by getting her to Children's Hospital after a car accident. I mean, it's just important to do it, isn't it?
That is true, yeah. Very important.
And you have to make that decision on the fly sometimes.
Right, exactly. And that's one of the decisions that we have to make, is not necessarily taking care of the patient and also stabilizing them, but also knowing the appropriate mode of transportation. If they, first of all, need a higher level of care, and can it, first of all, be done by ground transport versus air transport? And that's all part of the decision making that needs to be done by the emergency physician.
I know that you probably see a lot of patients who could be going to the physician's office, could be going to the weekend clinic that maybe they're not aware of.
Right.
We want to remind folks that Missouri Baptist does have a weekend clinic that's open.
Yes, we do. It is open actually on Saturdays and Sundays from 10 a.m. to 4 p.m. And it is open to anyone in the area to go to. If they believe that their condition is non-urgent, non-emergent, they can go there. But obviously for anything else, we're open to, and we'll be happy to see our patients.
And if it's a non-emergency situation, they probably save themselves some money by going to the weekend clinic.
Definitely, yeah. Definitely cost saving.
So, and they're taking walk-ins in. Or you
Yes.
could call and make an appointment, but they are taking walk-ins.
Definitely, they take walk-ins or by appointment.
So the clinic is always open on the weekend. Well, I know it's an emergency room is a very important part of Missouri Baptist Hospital, and I always tell people, how would you like to live in a community that didn't have one?
Right.
I mean, really, you've really saved lots of lives there.
Thank you.
So,
Yeah, we try our best.
we appreciate you coming in.
Thank you so much.
Thank you.
For the opportunity.
Dr. Amini is the ER director at Missouri Baptist in Sullivan. Thank you, and keep up the good work.
Thank you.
Appreciate it very much. It is 22 minutes.